It's my pleasure to introduce Dr. Carl Clark, who's the CEO of the Mental Health Center of Denver and a friend. He's a nationally recognized community mental health leader and has challenged the Mental Health Center of Denver to be the center of excellence with the best mental health services in the country. Trust me, I believe he's going to do this. He's led the way in using strengths-based and recovery-focused treatment and services. And I love when you talk to him what that means. Dr. Clark is the past board chair for the National Council on Behavioral Health Care. He also serves on several boards, including the Colorado Coalition for the Medically Underserved. Additionally, Dr. Clark, as I said, is a practicing psychiatrist. He kind of practiced on me that day, and an assistant clinical professor for the Department of Psychiatry at the University of Colorado School of Medicine.
Doug, I really appreciate you and your staff partnering with us to put on this town hall about growing successful children. And I'm very grateful that you guys showed up because there's something about putting on an event and inviting people and them not showing up, and I always worry about that a little bit. But I think I know why you showed up. You know, there are a couple of ways that you can live in a city. You can be a resident of the city, you have a place to live, you come and go. Or you can be a citizen of the city. And citizens are people that not only live in a city, but they have a passion and they have values, and they come together around things that are important. And for us, this is such an important issue, growing successful children. At the Mental Health Center of Denver, we know that everyone we see, from young children to the elderly, have things that they're naturally good at, things that are their strengths. And our goal is to tap into those strengths and leverage those so that people can get their life back on track. When we're talking about kids, it's about what is the spiral that set them off their course, and what is the resiliency that we can instill in kids to get that back and to help them move forward. Which is why we were very interested in bringing Paul Tuff to talk about his book, How Children Succeed, Grit, Curiosity, and the Hidden Power of Character. Character is central to the work that we do. The social emotional development of children is key to having an investment in our community that pays off in unbelievable ways. All of you have a book that's signed by Paul. It's a gift from the Mental Health Center of Denver to you. You're welcome to take that. And I'm really honored tonight to have not only sitting on a panel with Paul, but a couple of other community leaders. Charlotte Brantley is the president and CEO of the Clayton Early Learning. She's here tonight. Steve Nederveld is a program manager of mental health services at Denver Public Schools. And our own Dr. Lydia Prado, who's our director of child and family services at the Mental Health Center of Denver. Jeannie Ritter joined our group with a similar sort of mission about talking about mental health. And as First Lady, she was excellent at getting the conversation going in our state to talk about what affects 1 in 5 people. 1 in 5 people being affected by mental illness. And her goal as our mental health ambassador is to raise public awareness about that and to make it okay to talk about it. And she's doing an excellent job. If you haven't had a chance to meet her, I'd encourage you to do that. And we're hoping that by the end of the evening that you are so inspired and full of energy that you'll want to do something. So inside of your book, there's a couple of calls to action. There is a way to get a hold of me, Dr. Prado, or Jeannie Ritter, if you have ideas that come from the meeting tonight. And we would love to interact with you. The issues we face in our community around children is bigger than all of us, but all of us together can really do something. And then there's ways that you can be involved with our organization if you wish. We do an annual fundraiser, Gift of Hope, and that's also in your package. What can I say? We can use all the help we can get. And the last thing is that it's really very meaningful to me that you did show up. it's such a joy to see kids when they get their lives back together. And our community has a great need. And with that, I would like to introduce Paul Tough. And Paul is a best-selling author of How Children Succeed, Grit, Curiosity, and the Hidden Power of Character. He's also the author of Whatever It Takes, Jeffrey Canada's Quest to Change Harlem and America. Mr. Tough is a contributing writer to the New York Times Magazine, where he often writes about education, parenting, and politics. His work has also appeared in the New Yorker and Slate and on This American Life. So, ladies and gentlemen, please join me in welcoming Paul Tough.
Hello, everyone. Thank you, first of all, to Dr. Clark for that introduction, and to Doug Price for hosting us here today at Rocky Mountain PBS. And thanks to everyone at the Mental Health Center of Denver for helping to put this event together. My plan is to speak to you for about 20 minutes about my book, How Children Succeed, and then I'm looking forward to taking part in this panel and being a part of a discussion about how the ideas in my book connect with the work that so many people are doing right here in Denver. How Children Succeed at its heart is really a book about an idea. And the idea at the center of the book is that the conventional wisdom that has governed our thinking around child development for the past couple of decades has been misguided. We've been emphasizing the wrong skills and abilities in our children, and we've been using the wrong strategies to help develop those skills and abilities. The name that I give in the book for this conventional wisdom is the cognitive hypothesis. And what I mean by that is this sense that I think a lot of us share, even if we don't often speak it out loud, that the one quality that matters most in a child's success is his or her IQ. That it's all about that narrow band of cognitive skills that get measured on standardized tests. I think this idea is behind our national obsession with test scores. Even when we, as individuals, tell ourselves that these tests don't define us or don't define our children, as a nation, we've invested them with a whole lot of importance. And we do that because we really believe on some deep level that they measure what matters. But the educators and the scientists who I wrote about in How Children Succeed have identified this very different set of skills that they say matter at least as much as IQ, and probably more so. The list includes things like grit, curiosity, conscientiousness, self-control, and optimism. If you ask an economist, they'll tell you this is a list of non-cognitive skills. Neuroscientists often talk about executive functions. Educators often call these character strengths. But I think they also overlap with the sort of attributes of positive mental health that all of us want to see in our children. So when I started work on this book a few years ago, I started off by following two paths at the same time. First of all, I spent a lot of time reporting on people who were working directly with children, trying to help them succeed. And then I spent a lot of time reading the research in all of these fields, in economics, developmental psychology, neuroscience, trying to understand just what we knew about how children succeed. Something else happened just as I was starting my reporting that changed my perspective on these questions somewhat, which is that my wife and I had our first child. Our son Ellington is now 4. So I had the strange experience, especially during his first year, that I'd often be spending my mornings locked in my office at home reading these dense neuroscience texts about the importance of early brain development. And I'd spend my afternoons rolling around on the living room carpet with him and his stuffed animals. And I'd try not to let myself get too self-conscious about how what I was reading in the morning connected with what I was doing with him in the afternoon. But it was hard not to think of him as my little experimental subject. And the research that had the biggest impact on me as a parent, definitely during the first couple of years, all had to do with the biology of stress. And the person who guided me through that research more than anyone else was a pediatrician in San Francisco named Nadine Burke-Harris. I was drawn to Nadine at first because of her personal story. She grew up in relative affluence. She's the daughter of Jamaican immigrants, grew up in Silicon Valley. She went off to medical school and then to the Harvard Graduate School of Public Health. And then she came back to San Francisco, and still as a pretty young woman, she did this pretty daring thing, which is that she started her own pediatric clinic the first one of its kind in the poorest neighborhood in San Francisco, this neighborhood called Bayview Hunters Point. And at first, Nadine was like a lot of Harvard graduates. She thought she had all the answers to every question. And in lots of ways, she did. She was doing exactly what you're supposed to do as an inner-city pediatrician. She was improving the immunization rates for her patients. She was giving them the medicines they needed when they got sick. And yet, as time went by, she found herself increasingly haunted by this sense that what was really making her patients sick were things that she couldn't possibly immunize them against. It was the stress and the trauma, the noise and the violence and the chaos that surrounded them every day. The way she put it to me was that she sometimes felt more like a battlefield surgeon than like a primary care physician, just patching these kids up and sending them back into a war zone. And the frustration that she felt made her want to understand better what was really going on in the lives of her young patients. So she started to do this research. She especially looked at research around stress and trauma. She found this one study about the long-term effect of childhood trauma that changed her whole perspective on these questions, really changed her whole life. This study finds that if you take a group of adults, the ones who've experienced significant amounts of trauma in childhood have heart disease rates that are twice as high as normal. They have cancer rates that are twice as high, emphysema rates that are 4 times as high, suicide rates that are 12 times as high. And what we now understand is that the mechanism behind that phenomenon is stress. There are a lot of important systems being developed in the brains and bodies of growing children. But one of the most important, and until recently one of the least well understood, is our stress response system. Every infant experiences stress. A baby gets sad or scared or lonely, and she cries and wails, and then usually someone picks her up and comforts her and calms her down. And for most babies, that's actually a positive experience. The stress response system is in a lot of ways like a muscle, and it needs that kind of regular exercise in order to develop. The problem comes when children experience stress that isn't mild and occasional, but that is intense and chronic, what doctors call toxic stress. And toxic stress doesn't help develop the stress response system. Instead, it debilitates it. It damages it. And that damage gets right under our skin, and it can last a lifetime. We can see its effects on our physical health, on our mental health, and also on the development of this crucial set of attention and concentration skills that matter so much in school. So there's a lot in this research around stress that can feel a little daunting or even depressing. But there's some good news in it as well. And that is that there is a kind of antidote to toxic stress, a secret weapon. And the secret weapon is parents. When infants are able to form a close, connected, attuned bond with a parent or another caregiver, what psychologists call a secure attachment, it acts as a kind of insulation against even the worst forms of toxic stress. And one of the ways we know this is through this series of experiments that were done about 12 years ago in Montreal with rats. And one of my great fears is that my son is going to grow up and read my book and realize that most of the time when I was playing with him, I was thinking about rats. But it's true, and it's all because of these experiments that were done by this neuroscientist at McGill University named Michael Meany. And Meany was like a lot of neuroscientists. He had a whole lab full of rats, all living in these individual plexiglass cages. So each cage would have a mother rat and then a few of her babies, known as pups. And at a certain point, Meany and his researchers noticed that there was this one particular behavior that certain mother rats did and others didn't do. And they called it licking and grooming. And licking and grooming is not about trying to make your pups look more presentable. It's about soothing them and calming them down when they get stressed out. And if you're a lab rat pup, the thing that stresses you out more than anything else is graduate students. It's those lab assistants who show up once a day or so and pick you up and weigh you or measure you or inject you with something and then put you back in your cage. And when the lab assistants would put the pups back into their cages, the pups would be trembling, nervous, shaking, scared. And at that moment, some of these mother rats would do this soothing ritual, licking and grooming, and others would not. And so Meany wanted to try to figure out what the long-term effect of licking and grooming might be. So he devised this experiment. he divided the mother rats up into two categories. The ones who did a whole lot of licking and grooming, he called the high LG mother rats. The ones who didn't do much licking and grooming were the low LG mother rats. Each mother rat raised her pups just for the first week or two of their lives. And then the scientists separated the pups from their mothers. The pups grew to adulthood, which for a rat is about 3 months. And then the scientists gave these new adult rats a whole series of tests. And the rats who had experienced a lot of licking and grooming as pups did better on all kinds of tests. They were braver. They were more curious. They were healthier. They lived longer. They did better at mazes. When the scientists looked at their brains under a microscope, they could see differences in the size and shape of certain parts of their brain, all because of this one small idiosyncratic behavior that certain mother rats did just in the first week or two of their lives. So I spent a lot of time, especially during my son's first year, trying to figure out what it might mean to be a high LG human parent. I want to assure you I did not lick my son at any point. And if you look at photos of him from that first year, you'll notice my wife and I weren't that good at grooming him either, unfortunately. But I think there is a human equivalent to licking and grooming, and it's just the kind of holding and soothing, talking and singing that to so many parents comes so naturally. But of course, it doesn't come naturally to every parent. If you grow up without receiving a lot of licking and grooming yourself, it's harder to be a high LG parent. If you're raising children in poverty with all the stress and difficulty that that entails, it's harder to be a high LG parent. But what's most exciting to me about this research is that that style of parenting, that secure attachment, is something that can be taught. I spent an afternoon during my reporting in a living room in a home on the south side of Chicago where a teenage mom named Jackie was playing with her infant daughter named Michaela. And they weren't alone. There was also a home visitor with them from a social service agency. And, you know, there are a lot of home visitors out there. And often when home visitors go and talk with young parents, they talk about all sorts of important things like reading and vocabulary and health. What was interesting about this home visitor is that she was talking with Jackie entirely about her relationship with her daughter. She was talking about attachment, about how to make that dynamic more secure and more strong. And what the research shows is that this kind of home visit really works. The research now shows that with relatively short-term interventions, we can help parents really change their whole dynamic with their children to go from an insecure attachment to a secure one. And when that happens, a lot of important stuff changes for that child. We can see the effects in their brain chemistry. We can see it in their behavior, and we can see it in how well they do at school. Now, reporting this book took me to a lot of very different places. So one place was a living room in a very poor part of the south side of Chicago. Another was one of the wealthiest private schools in New York City. Part of my reporting, a whole chapter in my book, is about these two schools in New York that are doing this new experimental collaboration around character education. One school is the Kip Infinity Middle School, a charter school on the west side of Harlem that educates a mostly low-income population. The other is the Riverdale Country School, one of the most exclusive private schools in New York City. Tuition just topped $42,000 a year. The good news is pre-K is still just $41,000, so there still are some bargains out there. So these are two very different schools with very different student populations, and yet they decided to collaborate around this idea of trying to improve the character strengths of their students. One of the things that was interesting to me was that of these two school leaders, it was the private school head, a man named Dominic Randolph, who was much more concerned about his students and their character. Dominic was worried that his students, who were mostly from affluent families, were missing out on these opportunities to develop these important character strengths like grit and self-control because they were so protected from real challenge. Protected by their families, protected by their school, and really protected by their whole culture. Dominic was really especially concerned about the idea of failure. The way he put it to me was that character strengths like grit and self-control are born out of failure. And in most high-achieving academic environments in the United States these days, no one really fails anything. I wrote an article about what's going on at KIPP in Riverdale for the New York Times Magazine. And my editors gave it the headline, "What if the secret to success is failure?" I thought it was a great headline, very provocative. But I think it's a bit of an oversimplification. I don't think it's quite true that failure itself leads to success. Most of my reporting was in these high-poverty neighborhoods, and the problem for kids there is not that they don't have enough failure or enough adversity in their lives. In fact, they're surrounded by it. And for the most part, it doesn't make them stronger and more resilient. Generally, it just wears them down and wears them out. I think what we have in this country is something of an adversity gap, where we have some kids, especially those who are growing up in poverty, who simply have too much adversity in their lives, and what they need from us more than anything is some protection from that adversity. And then we have other kids, especially those who are growing up in affluence, who actually don't have enough adversity in their lives and could use a little more experience. I think it's that part of the equation that is especially difficult for parents to accept. I know that for me, when I think of my own son, there's something deep in my DNA that just wants to protect him from all adversity at any cost. But I think what I and a lot of other parents are coming to believe is that in doing that, in trying to protect our kids, we're often doing more harm than good. And that idea that a certain amount of adversity might be good when you're growing up recently got some support in the psychological literature by this study that was done by a team of psychologists at the State University of New York in Buffalo. These researchers took a group of 2,000 adults, and they gave them all 2 tests. One was an adversity questionnaire, just this checklist of different adverse events that can happen to you in childhood, and you had to check off a box for each one that you'd experienced. And it wasn't sort of terrible, traumatic events. It was things like your parents get divorced, or someone in your family loses a job, or you survive a natural disaster. And then the second test was a standard psychological evaluation of happiness and mental health and well-being. And for the most part, the researchers found the relationship between these 2 tests that was exactly what they expected. The people who had experienced all kinds of adversity, who checked off 12 or 15 boxes on that adversity checklist, they weren't doing well at all. That adversity had affected them psychologically, and those effects were continuing well into adulthood. But then the researchers noticed something curious in their data, and that is that there was a group of about 200 respondents in this larger group of 2,000 who hadn't checked off a single box on that adversity questionnaire. They hadn't experienced any real adversity in childhood at all. And so the researchers looked at the slope on their graph and they thought, oh, well, these must be the happiest and best adjusted people in the whole country. But of course they weren't. Their happiness and mental health scores were no better than people who'd experienced 8 or 9 adverse events. And the people who were doing best were the ones who had experienced 2 or 3 or 4 or 5 adverse events growing up. It turns out that the relationship between childhood adversity and happiness is an inverse U-shaped quadratic equation, a handy fact to know as you go through life. I've been speaking a lot recently to groups of parents, and there's sometimes one particular type of super anxious parent that I'll sometimes get who'll raise their hand and say, okay, enough with the rats and the science. I just want to know how to get my kid into Harvard. They'll hear about that inverse U-shaped quadratic equation, and they'll be like, okay, go over it again. What did you say was the perfect number of adverse events? Was it 3? Because I think I could do that. What about a divorce and 2 natural disasters? Would that work? And I have to explain that, no, I don't think that's actually the right approach. It's not that we need to manufacture adversity for our kids. I think kids, whether they're growing up in affluence or poverty, they face adversity all the time, on the playground, in social situations, in sports, at school, with siblings. What matters more than anything is how we, as the adults in their life, respond to those failures. I think there are a lot of parents who say the right thing about failure and adversity, but when their child experiences a setback and how we respond, we often send exactly the opposite message. Now, for kids who are growing up in high-poverty neighborhoods, I don't think that the answer is to let them fail more. If anything, I think we've been letting them fail too much and for too long. With them, I think we need a whole new approach. There's a lot about this research around brain chemistry and disadvantage, stress and trauma and attachment that I find to be just fascinating and important. But I think there's a risk in writing about it and talking about it the way that I have. And that is that I worry that it can make us feel complacent or even fatalistic. Sometimes the neurochemistry just seems so powerful that we can't imagine that any child who grows up in deep disadvantage, surrounded by toxic stress, with insecure attachment, we can't imagine that those kids could ever go on to real success. And yet, of course, those success stories happen all the time. Any of you in this room who work directly with children can think of a few, and there are a few that I write about in my book. And what I find with all the young people that I've met who've started out in deep disadvantage and gone on to real success, they all share two things in common. One is character. They all have deep reserves of these character strengths, like grit and resilience and hope and optimism. But the other thing they all share is help. There was someone somewhere along the way who reached out a hand when they needed it the most and helped them get to the next rung on that ladder. And so I hope in the end that this research doesn't make us fatalistic or complacent. I hope it makes us want to help more. Now, that gets us to the work of the Mental Health Center of Denver. And I don't think that there are clear and easy answers on exactly how best to help at any one stage. But I think there's a lot that we know and a lot more than we used to know. So that's what the panel discussion that we're about to move into is going to be all about. Different ways to use this research to help children in need.